Elvira. Thank you for accepting my invitation to facilitate a workshop for the International Society of Hypnosis.
Well, thank you so much for having me. It is quite an honor and a delight, I have to say.
Okay, great to hear that. And it's a privilege for us to have a webinar with such a savant person. And I know that you have faculty positions in several universities in Germany and in the United States.
That's correct. I originally started in Heidelberg, my good alma mater. And then in the States, you know, I was at Stanford, University of Iowa, and Harvard.
Great, great. And the topic of your workshop is hypnosis for the operating room. And I know that you are an interventional radiologist. So I'm curious to know, what are you going to teach us in this workshop as a medical doctor?
Well, you know, it is based on my experience having throughout most of my life done procedures on awake patients and also facing the whole issue of anesthesia and how some people are more afraid of getting it and all these changes. So I will focus on the following points, like the whole operating room dynamics, because I've often seen people who are very experienced hypnosis practitioners. When they are asked to help in this environment, they may be put off because you do not have those 45 minutes you might have in a private office to consult with a patient. Or it is also geared to help those who are preparing a patient to go into this environment, because this environment is rife with a lot of negative suggestions and negative hypnotic experiences. So I'm going a bit into that. How can one thrive if called into this environment to help a patient? Or also when one prepares a patient, what to prepare the patient for. But then also what's coming up more and more, what I see, is the self-care. Let's say if we, as a person who believes in hypnosis, and we know we can make it through a surgery with hypnosis, like I had my hip surgery with hypnosis, and yes, you get a spinal block, but everybody nowadays wants to put you out, yeah? And so I want to bring in a bit of self-care, like how can you manage the situation, and to also kind of realize who is getting the sedation or anesthesia. It's typically for the surgeon, it's not for the patient. Yeah. So I'm gonna talk about a few techniques one can use to calm one's surgeon down, or particularly calm one's anesthesiologist down. And then on the other hand, how can we actually really become allies with anesthesiologists? Because the whole field is moving towards, it's called local blocks, where you give a medication with which you do not want the patient to be completely out. Because traditional lidocaine, you know, you give for numbing up stuff, it's very hard to kill someone with it, yeah? I mean, keep in mind, if somebody has a heart attack, you give 40 milliliter of this stuff, whoosh, and it's fine. But if you use these longer acting ones and only a small amount gets into the bloodstream, you have to do something, otherwise, well, you may lose the patient. And if your patient's deep asleep, the patient isn't gonna tell you if something's not working. So I'm gonna go into that. And the very last point I will be bringing on is the symbolism of disease. I find more and more, and I've seen that in my practice, people come to get a surgery or a procedure that they think will help. But often in the way they present their findings, there is so much symbolism in that unless you address that, you may not realize that if you give that patient their back surgery for what they describe, I can't get up and I can't walk, for a person who is in a bad situation. You mean, see the symbolism. You do the surgery, it's not gonna work. They're gonna develop something else.
Okay, I saw in your abstract that you wrote this dash is. So this is that symbolism that you talked about. And I really like that.
That's exactly it. It's something that, there is an entity between the mind, the physiology, and what expresses itself physiologically. And you have to address it as a unit.
Yes, as an uncomfortable, let's say, situation.
Right.
Okay, great. So I'll be enthusiastically looking forward for your workshop. And I'm sure that it will be a very nice workshop, and I'm sure that our audience will love it. But would you please tell me very briefly, are you going to teach us some techniques as well?
Oh, yeah. Well, I'm very practical
Okay,
from
great.
my background, kind of more the
And
surgically
will we have
oriented.
some, please?
Yeah, the surgically oriented mindset is more kind of now and practical, and whatever works. I don't necessarily need to know why it works, as long as I know it has worked in large clinical trials we did, and these were the behaviors we did, and they got the positive patient outcome. So I'll be going into that, and very concretely with some examples.
Great. And it will be nice if you uh, have some demonstration as well.
Oh yeah, I have little videos. Yep, and
Great.
oh yeah.
Great.
Oh, and you may want to warn the audience in my work.
Yes, a live demonstration if you don't
No,
mind.
no, no. They have to work. It is called a workshop, and I'm not the only one. No, no, no. They get little tasks to do.
Okay, great. Great. Thank you. Thank you very much, Elvira, for accepting my invitation and for participating in this interview. Is this anything else that you want to add?
Well, I'm just looking very much forward to it because, in the National Society of Hypnosis, there are just some amazing, amazing people there. And so I know I'm going to learn a lot too from the input of the audience.
Great, great. And our workshop will be at Tuesday, 20th of May, because usually it is on the third Wednesday of each month, but this month it will be on 20th of May on a Tuesday. So I'm inviting all the people who are an ISH member, or even those who are not yet an ISH member, but like the subject and the use of hypnosis in the operating room. So we'll be waiting for your workshop. Thank you, Elvira.
Well, thank you very much.